Good morning. I'm Joe Kipley, the Public Health Director for the City of Sioux Falls, and I'll be joined today to celebrate National Health Center Week with Dr. Susan Olson, our Chief Dentist for Falls Community Health, and also Shelley Ten-Naple, the CEO of Community Healthcare Association of the Dakotas, or CHAD. And so we're just here to celebrate our health centers across the nation, and also I've got the executive proclamation from Governor Roden. It's also in the state. It's South Dakota Health Center Week. And so just proud to be part of that network of health centers. So Falls Community Health is a city-owned venture, but we're also a federally qualified health center. So as an FQHC, we get some federal funding, and that helps us basically be a clinic of last resort for certain individuals, especially in the downtown community. So we take all comers and serve people of all socioeconomic status in the downtown community, but we are a subset as Falls Community Health within the health department of the City of Sioux Falls. Being a federally qualified health center kind of makes for a unique governance structure for the clinic. Of course, it's a city entity, but then we also have a board of directors over Falls Community Health that is about 50% comprised with patients of the clinic. So that's a fun thing to have different experts from different industries in the community serving on a board governing this Falls Community Health clinic that has primary care services and dental services, but then knowing that some of your board of directors are getting care with your providers at that clinic. So they give some of the best and most practical feedback for how to make our clinic better. So just to give you some sense of scale of what Falls Community Health does, we've got when you add in the part-time staff as well, we employ over 100 staff to be physicians, nurses, front desk staff, billing staff. We also partner with Center for Family Medicine for their medical residents and faculty are some of our providers in the clinic. And we serve anybody. So that's part of our FQHC status. We don't turn anybody away for their lack of ability to pay. And we do have 39% of our patients are Medicaid patients and 32% are uninsured. We're able to put especially those uninsured or underinsured on what we call a sliding fee scale. So based on their income information they can give us, we can discount the amount that they have to pay. So we think that we provide a great service to the whole community of Sioux Falls and especially in the downtown area. And I think some as downtown is becoming more residential, we want more downtown residents of whatever their socioeconomic status, whatever their insurance status, for health insurance or dental insurance to know that Falls Community Health exists. And without Falls Community Health, and I think that's what we're celebrating even across the state of South Dakota, these types of community health centers, the burden they take off of the health systems and emergency departments and rural ambulances to know that there are primary care providers in these communities in rural settings all the way to downtown Sioux Falls. But I think one of the differentiating factors and things I really love about Falls Community Health is our dental program. So I'm going to bring up Dr. Susan Olson to speak to the dental services at Falls Community Health. Dr. Olson?
Good morning, everyone. I'm Dr. Susan Olson, the Dental Director at Falls Community Health, and I'm happy to be here today in celebration of National Health Center Week. At our clinic, we provide well over 7,000 dental visits each year. But those numbers just scratch the surface. Behind every visit is a patient with a story, a child in pain, a parent under stress, or a neighbor trying to stay healthy. Oral health isn't just about the appearance of teeth. It's about preventing disease, supporting nutrition, and restoring a sense of well-being and self-confidence. As a federally qualified health center, we are proud to serve our community by offering care that's accessible to anyone, regardless of income or insurance status. We're also uniquely positioned to fill a critical gap, especially for those who have nowhere else to turn. We understand that life circumstances can happen to anyone at any time, and that can create barriers to care. But that's why we're here. We're here to help bridge those gaps with dignity and compassion. One patient that comes to mind had been silently suffering with severe dental pain for weeks. She was uninsured, working 2 jobs, and trying to care for her family. all while enduring an infection that had spread across her face. The pain kept her up night after night, and the swelling was so intense that she was too embarrassed to be seen in public. She had told us that she had almost given up hope on finding help until someone had told her about our clinic. She walked through our doors desperate, exhausted, and afraid, but we were able to help her that same day. We were able to manage her infection, and as that pain started to ease, she broke down in tears, not just from the relief, but because someone was listening to her, they'd seen her, and helped her without judgment. Later then, she had said, "I feel like I can breathe again." Another example comes from one of our school-based clinics where we were able to help a second grader who had pain all over his mouth. His parents had transportation challenges, so they weren't able to take him to any dental clinics in town. But luckily, because we were on site at his school, we were able to take him out of class and seamlessly treat him without any delay in care. He was very frightened when we started his treatment, but my team met him with a lot of patience, a lot of reassurance, and maybe a little bit bribery with some toys and stuffed animals. But he walked out of our clinic smiling ear to ear, and his parents were incredibly thankful. This is the heart of what we do, and this is the power of community health centers. Through partnerships, compassion, and access, we are helping to create a healthier future for all. Thank you for letting me show you a little glimpse of what we do in our dental department at Falls Community Health. With that, I'm pleased to introduce Shelley Tenepel from CHAD.
Thank you so much. You know, I have a few remarks, but one of the things that we celebrate in National Health Center Week is the amazing people that work at health centers, and what a fantastic job it is to be able to work in the environment of a health center. And so I was just thinking of that as you were talking, and I know even as we were chatting earlier, you were talking about how you feel like you're really meeting a need in Sioux Falls. And I think for those people who are out there saying, I want to find a career where I can really make an impact and serve those in need, and have those whole person care kind of experiences, I think community health centers are for you. So with that, I do want to just say happy National Health Center Week to everyone. We're so excited to celebrate with Falls Community Health. And I work for the association, so I lead the association across North Dakota and South Dakota. So we have members across the state. We have 6 organizational members. We're in 38, we have 38 sites, and we serve over 130,000 patients across South Dakota. So in each community, a health center is going to look a little different because it's really going to be responding to the needs of that community and gaps in care that might exist in that community. But the through line across the health center movement really is just believing that everyone who's sick should be able to see a doctor and get the health care that they need. So really focusing on that access to care. So in rural communities, we might be the only healthcare access in town. It might be, a lot of those frontier communities are really difficult to serve from a health center perspective. And then in urban areas, you're gonna see a patient population that's gonna look a lot more like Falls Community Health. So that just gives you a little bit of a sense of who we are across the state. For National Health Center Week, we're celebrating 3 things. One, we're really honoring our health centers and shining a spotlight on them. I think I hear more often than I'd like to, I didn't know you guys existed, or I've never heard of a federally qualified health center or a tribally led health center. So we're really trying to shine a spotlight on the work that health centers do across the state. We're celebrating the people behind the care, so talking about all the amazing people that work at health centers and continuing to welcome more in. We know that we're really in a workforce shortage across the Dakotas, and so we're always looking for to add people who want to be a part of the work that we do. And then finally, recognizing the heart of health centers, which is our patients. So, everything that we do orients around how do we focus on the needs of an individual person, and how do we advocate for at our level, at the association level, and then serve with healthcare those who need it. So with that, I do want to just turn you to a couple of resources that we have also. So our website has lots of information about health centers across the state. So that's communityhealthcare.net. We also have a National Health Center Week webpage, so you can find that off of our main site if you'd like to check that out. And we just put out a new video that kind of tells the story of health centers, so you can find that there. It's a 3 to 4 minute little video, but if you'd like to learn more, that's a great place to start. So with that, I will turn it to those who may have questions, and back to the team here.
Thank you, Shelley. Yes, sir.
Joe, obviously, it's a shifting environment in the world of Medicaid and reimbursements in general. How much stress is this putting on the finances of the health clinic?
Yeah, so Falls Community Health is, I would say, not immune from that issue, but we're a little isolated. We get reimbursed on a prospective payment system, basically a model of per patient visit. We get a set amount from the state Medicaid office, and that's based on our cost reports. So ideally, that is covering our costs. Does that always work out, and does the math work out perfectly that Medicaid is perfectly covering our costs? No, but we have conversations almost monthly with the state Medicaid office, and they know that I think we're kind of in the same boat, the state Medicaid office and us, because again, we're providing a service that we're trying to keep people healthy and out of the emergency rooms, where state Medicaid would be paying a lot more for those services. So I think you'll see that state Medicaid and a lot of bipartisan support at the federal level for community health centers, so not just Falls Community Health, but you'll see that even though I think we saw in the One Big Beautiful Bill some cuts to Medicaid, we also see some new funding investing in rural healthcare. So time will tell to see how that really shakes out, but we're cautiously optimistic at Falls Community Health that we've got a good working relationship with the state Medicaid office, and we know that that's a big part of our book of business, if you will. And then for our uninsured patients, we have that sliding scale, and there we get federal grant dollars that help backfill that we're kind of writing off the balance for certain patients, but we know we're getting some federal money in exchange there. So between state Medicaid, federal partners, and then local, obviously city subsidizes some of the clinic as well. We've got all different layers of government, for better or for worse, are helping us out, and we're trying to row the boat in the same direction, that we know that if these patients sought care elsewhere, it would actually be way more expensive. And so that's something with the CHAD Association and whatnot, some of our sister clinics around the state. That's what we try to preach to the state legislature, to state Medicaid office, that we're here to help patients first, but also we can help the bottom line of state Medicaid program by actually saving them money with preventive services.
And that works the same for dental? Doesn't matter the patient?
Correct. The payment model is a kind of a per patient visit for Medicaid services.
And how many people in Sioux Falls annually, roughly?
So we see roughly 20,000 medical visits and around 7,000 to 8,000 dental visits at our Falls Community Health site.
How do you think, if the closing of the school-based clinics, because they're primarily adults and they wasn't really serving children, but how will that affect the core here? Do you have the resources to be able to?
Yep. So a couple things on that. The first point would be that our dental clinic operations have been very successful at the school-based sites, and those will continue. The medical sites is kind of what we're recalibrating and seeing how can we retrench back to the mission. A lot of our primary care medical services are at the downtown location, and bringing those providers back to have them mainly located at the downtown location is just going to be more efficient, more economies of scale for the primary care medical services to run patients through that. But that's something, frankly, we're having some ongoing discussions with the school district. How can we best serve these communities? And right now we're leaning into dental, but we're open, and again, back to intergovernmental relations and collaborations. I think you'll see some more things coming with the school district of how we can make this community even better, and some other collaborations in the future, but dental is where we're seeing the biggest bang for the buck.
And what do you think, what's your capacity? Say, this video goes viral, And all of a sudden, you've got people coming in from all over. Like, how many can you serve?
Yeah, in some sense, are we the best kept secret of downtown Sioux Falls and people just don't know we exist? That's part of this. We want to raise awareness and have people seek our services no matter their socioeconomic status and insurance status. But I think where we have capacity is with our partnership with the Center for Family Medicine. So we kind of have a group, basically a medical group. We're the clinic, but then there are between first year, second year, third year family medicine residents, and then the faculty that oversee them. We have capacity. And so, yes, we would love to be overrun by demand of people seeking our services, and we would like to tailor our staffing model to that demand. But right now, we're at a pretty good point and we have capacity. You know, we have, on any given day, we've got a hallway of exam rooms that are not utilized. So we could pull in some more support from our own nurse practitioners, again, back to retrenching them back to the downtown area from being based at a school site. And then also our partnership with family medicine residents and faculty. We think we can, again, run a more efficient FQHC clinic downtown if we're running more at capacity. So we have a little bit of capacity right now that I would love to fill.
Do you think, I mean, most of the patients come from pretty close around downtown, or is the message getting out to, there's plenty of people of lower income levels that live on the edges of the city. Are those folks coming in as well?
Sure. When we do a zip code analysis, I couldn't tell you, but we serve all segments of the city. But then, of course, there's some concentric circles to that there's some more emphasis on the downtown area. I know almost it's close to 10% of our primary care services have a nexus to the homeless population in downtown. So we're sometimes seen as that clinic of last resort. And that's kind of a fun initiative that in partnership with Midwest Street Medicine is going to the homeless shelters and doing that classic street medicine. We're trying to follow on their heels, and we've had our lead physician, Dr. Jen Tingley, going to the Bishop Dudley homeless shelter once a week to try to manage some of that care and ideally build trust such that people would be willing, rather than we just have more resources at a clinic. Midwest Street Medicine is doing some great work, but they're making referrals to us and trying to build that trust in some of those pockets of communities that don't trust physicians, maybe had a bad experience with physicians in the past, and trying to build that trust so that they'll come to our clinic. So transportation is maybe just one on a list of endless barriers to care. So when we're dealing with the downtown population, there's a few unique issues that we have to kind of work through the ecosystem of downtown. So I would say we're trying to rally the troops to focus some on the downtown, but we also have community health workers that are helping people with transportation issues. And so, yes, we definitely do have people from all zip codes around the city utilizing our medical or dental services. Thanks, Patrick.
Any others?
Any other questions? Otherwise, we will sign off. Thank you all for being here.